Welcome back to MedSimpleTv. Today, we'll learn how hospitals prevent infections and keep patients safe. These simple practices protect patients, healthcare workers, and visitors every day. What is infection prevention? Infection prevention means stopping germs from spreading. Germs such as bacteria and viruses can move from person to person. Good infection control helps prevent illness and saves lives. Hand hygiene is the most effective way to prevent infection. The World Health Organization recommends cleaning hands at key moments: before touching a patient, before a clean or aseptic procedure, after exposure to body fluids, after touching a patient, after touching the patient's surroundings. Healthcare workers should use alcohol-based hand sanitizer or wash hands with soap and water whenever hands are visibly dirty. How hospital infections spread. Infections spread through droplets from coughing, sneezing, direct contact, and contaminated surfaces. Germs can also survive on surfaces such as bed rails, keyboards, phones, stethoscopes, and door handles. Without proper precautions, infections can easily spread from one patient to another. Personal protective equipment, or PPE, helps block germs. Common PPE includes gloves, masks, gowns, eye protection, and face shields. PPE creates a barrier between germs and the body. However, PPE only works when used correctly and removed safely to avoid contamination. Sterilization versus disinfection. Sterilization and disinfection are not the same. Sterilization destroys all forms of microbial life, including bacterial spores. It is used for surgical instruments and critical medical equipment. Disinfection reduces or kills many harmful microorganisms on surfaces and equipment, but may not destroy all spores. Both methods are important in preventing healthcare-associated infections. Safe waste disposal in hospitals. Hospital waste must be handled carefully. Used gloves, masks, dressings, and needles can carry infectious materials. Sharps should be placed in approved sharps containers. Medical waste should be separated and disposed of according to hospital guidelines. Proper waste disposal protects healthcare workers, patients, and the environment. Common hospital-acquired infections. Hospital-acquired infections, also called healthcare-associated infections, develop during medical care. Common examples include urinary tract infections, surgical site infections, bloodstream infections, and pneumonia. These infections can increase hospital stays, treatment costs, and complications. Infection prevention tips for clinical rotation. If you are a nursing student or medical student on clinical rotation, always practice proper hand hygiene, follow hospital infection control policies, wear appropriate PPE, avoid touching your face, clean shared equipment, and report any exposure incidents immediately. Good infection prevention habits learned today will stay with you throughout your healthcare career. Infection prevention is everyone's responsibility. Every clean hand and every safe practice helps stop the spread of infection. Thank you for watching MedSimpleTv. Subscribe for more health tips and learning resources.